Hello, my name is Kimberly Thompson. I am a student physical therapist assistant from CBD College. My patient is Jamal, an active 43-year-old dentist who ruptured his left Achilles tendon during a weekend tennis match. Jamal has been referred to physical therapy for rehabilitation. He is now permitted to bear partial weight on the involved foot with pain tolerance while wearing the orthosis. I'm going to demonstrate some sequence of exercises and criteria for Jamal's progression. What precautions are included in your treatment plan? Carefully progress all exercises that intentionally place resistance or stretch on the gastroc soleus muscle group, following post-operative guidelines to avoid injury or a delay in healing. Postpone all unilateral weight-bearing exercises on the operated side until full weight-bearing without pain is possible. Describe the additional intervention strategies that will be used to prepare Jamal to return to playing tennis. After 12 weeks, if Jamal meets the following criteria, he can advance land-based training program, which is going to be running, plyometrics, etc. He can ambulate pain-free with normal gait and no assistive device. He has a normal dorsiflexion range of motion. He can complete 5 unilateral heel raises at 90% of the limb's maximum heel rise height. Land-based training programs include, this begins with bilateral land-based plyometric activity, teaching the individual correct land techniques. Then advance to unilateral activities when proper joint alignment and controlled deceleration on the operative limb is achieved. Initiate returning to running progression on a level treadmill. Wear a prescribed functional ankle foot orthosis or tape the ankle during high impact, high velocity activities to minimize the risk of a tendon rupture. So the first exercise that I'm going to demonstrate is going to be an anterior tib stretch, which is going to look like this. You're going to bend the knee on the involved side until you can touch your toes on the floor, like so. Scoot forward in the chair until you can feel a stretch along the front area of your shin. You're gonna do this 3 times a day. Hold for 15 seconds and progress to 30 seconds afterwards. This is going to stretch the anterior tib and counteract the effects of the stiffness from the short cast. So the second stretch that I'm going to do is going to stretch out your gastroc and your soleus. It's called a gastroc and soleus stretch, and it's going to look like this. And you can do this using a towel, using a light resistance TheraBand, a belt. Look like so, and sitting on the floor or in your bed with your involved leg straight out in front. Actually, you're gonna want to bend this leg out in front of you. Drape a towel or a belt around your foot. Pull up towards you until you feel a stretch. So like so. Pull up. Perform with your knee as straight as well as with your knee slightly bent. You're gonna do this 3 times a day, hold for 15 seconds, and then progress to 30 seconds. This is going to stretch your gastroc and your soleus using the non-weight bearing precautions. Like so. The third exercise that I'm going to have this patient perform is going to be an inversion eversion. You can do this in supine or you can do this in long sit. You're going to bend your ankle to move your foot outward or away from your midline. So it's going to look like so. And you're just going to do these movements here. You can relax and repeat. You're going to repeat this 10 times 3 times a day and progress to 15 times a day. This is going to improve your ankle range of motion for inversion and eversion. And also as the patient progresses, they should be able to somewhat work more so into their dorsiflexion, which is going to look like this, and be able to invert and evert with their dorsiflexors easier as well.